There's one phrase I hear just about every day of my career, and that is, I didn't want to waste your time, doctor. And my standard response to that statement is, no patient has ever wasted my time. I'm Dr. Matthew Glotterman. I've worked as a doctor for nearly a decade, from pediatrics to palliative care, many specialties in between. And in this video, I'm going to walk you through why patients might feel that way and why you shouldn't, what your job is as a patient, what my role is as a doctor, and why there's some nuance, meaning there's some things that you might think are minor, I might think are really worrying, and vice versa. So, why do patients feel this way? I think there's three key reasons. One, some patients just don't want to bother doctors. I work in Cumbria in the UK, so kind of Lake District area. There's lots of farmers in the area that I work at. Lots of people that I call them like tough Cumbria stock. People that just get on, crack on with things. If something's bothering them, they wait and wait and wait and wait, and then finally they get seen. Why is that a problem? Because oftentimes I'm seeing late presentations for really worrying things. So things like cancer. If you catch cancer early, outcomes are really good most of the time. If you catch it really late, sometimes there's limits to what we can do in the healthcare profession. So making sure that you're getting seen when you start noticing symptoms is really important, because you might not know, is this something bad or not? Second one, a lot of patients, a lot of families are aware that there's pressure on healthcare systems. I work in the NHS in the UK, and it's in the news. There's wait times. Sometimes A&Es will say, you got a 5-hour wait before you get seen by a clinician. That's not entirely true, because they're triaging everybody so that, if it's something that's super worrying, then you're going to get seen quicker. But people understand that there is a lot of pressure on healthcare professionals. Doesn't matter if it's a hospital or community setting. And sometimes they struggle to even get in to see their doctor. My hope would be that somebody's triaging you, meaning like understanding what are the symptoms you're coming with, ruling out some of the worrying things, and then figuring out when's an appropriate time frame for you to be seen. But if you're worried about that pressure, please know that your job is to present when you're worried about things. The last thing is a past experience. So what do I mean by that? If you went to a healthcare professional, doesn't matter who it is, and you felt like you weren't listened to, maybe you felt like, that they were rushing you out of the room, or they didn't have time for you. That's going to color your perspective of how things will go in the future. And that's a really dangerous spot to be in as a patient or a family member. Why? Hopefully, that clinician that you saw, they were just on a bad day or a bad week, okay? But equally, I work with tons of people, I call them superstars within the NHS, people that are incredibly dedicated healthcare professionals. They love what they do, they're passionate about their work. The thing I think about all the time, we lost my wife's mom during medical school to an aggressive brain tumor, and it's never been lost on me since that time that each interaction I have with a patient or their family member might be one of, if not the most important moments of their life. That means I've got to be on all the time, because I might miss something. I might make a mistake that can affect somebody's life for decades, affect a family's life for decades. And that's not a responsibility I take lightly. So if you've had a bad previous experience or multiple bad previous experiences, my hope is, that clinician that you had a bad experience with, maybe that was just they had an off day or an off week, but equally you find somebody that you feel listens to you, that you feel helps and supports you and is there to be there for you. So what is your job as a patient? Your job, or a family member supporting a patient, your job is to call and come when you're worried about something. There are 3 scenarios where I tell patients specifically, call as often as you need to. That means multiple times a day if you needed to. First situation is young children. Second one is mental health. Third one is palliative care. The most vulnerable groups, and I've worked in all 3 of these settings. I've worked in crisis team, I've worked in palliative care, I've worked in a pediatric hospital. So infants, especially the first 3 months of life, they have an immature immune system. They're very vulnerable. As a young parent, I don't have children, but I can imagine how protective you are, how you want to help let them grow, nurture them in a safe environment. And you might not know, is this something that's really worrying or not? Trying to guess that as a parent with all the lack of sleep, the getting up and down, trying to feed them, trying to protect them, that can be really challenging. So if you're worried about a little one, it's really important to get seen quickly so a doctor can either figure out if there's anything wrong or reassure you and give you some information. Second bit, mental health. So if you're in a mental health crisis, you have acute psychosis, meaning you can't think properly and you don't have insight into that, and your family members will probably be able to support you in that context. You might need crisis team involvement if you're suicidal. These are really delicate, difficult times, and it might be one of the worst moments of your life, the week or month of that period. And so you're needing regular interaction, sometimes daily, sometimes multiple times a day, and that slowly gets spaced out as you feel more supported and get over the acute crisis that's going on. And then palliative care, the whole branch of medicine to get this stage of life right. And having worked in a hospice for 6 months in palliative care, I know how important that is, both professionally and personally. We didn't have a lot of support when my wife's mom died, and so it was extremely difficult. Some people were great, some not so much. But I tell patients and families all the time, if you're struggling, if you're suffering, don't wait till the morning, don't wait, just call someone straight away. We're trying to support someone, and in the community, as a doctor who works in urgent care and general practice currently, that is my emergency. I am going to see someone. I might drop everything if somebody's suffering in the community in the last moments of their life. That means last days, weeks, months. So what's my job as a doctor? One, hopefully I can figure out what's going on. And there's nuance to that. In my mind, I always have kind of 3 options about what I'm doing. One is I can manage this right now, and I think I've got a good idea, and I can give you some treatment and hopefully it gets better. Second one is I've got to do some investigations. I've got to dig into this a little bit, but I have some time. Third is, no, you're really unwell. You need to go to the hospital right now. And there's gray areas in between that. Some people are borderline hospital people. Maybe I can manage, try some treatment and see, do some investigations. Some people they don't need to go to the hospital right now, but maybe we're worried about cancer, so I've got to investigate quite quickly to make sure that we get a diagnosis potentially quickly, and then we can start treatment straight away. Third one is, well, you maybe could be managed, could be investigated, and then I let patients collaborate with me and try and work out what they think is best and suited for them at that moment in their life. The other job I have is to rule out the worrying things. So when you present with a problem, I am asking negative symptoms. That means I'm asking specific questions to target really worrying things that might escalate you to the hospital if you're having those symptoms. And the other thing I'm doing is trying to arm you with knowledge. We call it safety netting, where I'm explaining to you, if these 5 things happen, I want you calling straight away, or I want you going to the hospital. Because I've dedicated decades of my life to knowing about healthcare. It doesn't mean you have to know everything. But if you present with a problem, I need to be able to explain to you, let's say it's abdominal pain. Present with abdominal pain, I need to explain to you if you're having a rock hard, rigid abdomen, if you're having really high temperatures, full body shakes, confusion, if you're having significant blood loss, or black sticky tar-like stools, any of these things make me worry, you got to go to the hospital right away. So part of the reason I'm making this channel is to arm you with knowledge so that you are able to think about what could go wrong and when I need to get support and how quickly I need to get support. The last thing is there's a lot of nuance to medicine. What does that mean? It means that some things that you might think are minor might be major to me, and vice versa. So you might be really, really worried about something. You might have looked something up online and you think, this is really bad. And you come to me and I say, actually, it doesn't sound like that disease pattern, it doesn't sound like that condition. Here's what I actually think is going on. Here's what we can do. Here's how we can investigate that. Or vice versa. I've had patients who've come to me and they kind of say, maybe they have 5 problems. And one of my standard questions that I was taught not to ask at the end of every consultation is there any other questions you have? And that opens up doors to possible worrying things. And that's why I ask that question to my patients. So I've had patients say, oh yeah, I've been coughing up blood lately and I didn't know if it was something to worry about. It doesn't happen all the time. And then I'm asking if they've had weight loss, and I'm asking if they have a smoking history, and I'm asking if they have cancer history in their family. And I've had patients who have mentioned something very minor to them that ended up being cancerous, or it ended up being something where they need to go to the hospital right away. Oh yeah, by the way, I have some chest pain. Okay, tell me about that. That's much more worrying than the skin rash that you presented with. So there's lots of nuance, and your job is not to figure out which one's the big thing, which one's the worrying thing, which one's the minor thing. That's my job. Your job is to present what's going on, what symptoms you're having. And then I've got to work out in my mind what we need to do about it and how quickly. So hope this video helped you. If you're worried about something, please get seen. And if you like this video, you can share it with other people so that they know what to look out for and how to manage different situations with their healthcare professionals. Thank you.